titingnan nyo is your bradycardia algorithm. Your bradycardia algorithm. Now, can you give me an example of an ECG that will dictate that you are on a bradycardia? Okay, very good. You have your sinus bradycardia. Your sinus bradycardia. It says there on your algorithm that the sinus bradycardia, once you see it, anong sabi ko? You need to check for pulse. You need to check for pulse. So the question now of the team leader would be, is there a pulse? So once you see the ECG, the question now of the team leader would be, is there a pulse? Now, if the team member, by the way, sino ang mag-check ng pulse? Sino ang mag-check ng pulse? So kung sino yung pinakamalapit sa pasyente, siya ang mag-check sa pulse. So sino bang pinakamalapit? Ang i-assign natin would be your ventilator. The ventilator now would be checking the pulse of the patient. How many seconds nga ulit ang pag-check ng pulse? 10 seconds maximum. 10 seconds maximum. Now, pag sinabi niyang there is a pulse, the next question of your team leader would be, what is the pulse rate? What is the pulse rate of your patient? Why? Because there is a certain category that we can only use your bradycardia algorithm. Anong sabi dyan? The pulse rate of the patient should be equal or less than 50 beats per minute para magamit mo yung algorithm na yan. It should be what? It should be less than 50 beats per minute. It should be less than 50 beats per minute. Now, if there is no pulse, anong ibig sabihin nun? That is already your pulseless electrical activity. So you need to go back again to your cardiac arrest algorithm. So ibig sabihin yan, kapag hindi na-fit yung scenario ng pasyente mo based on the things na minamanifest niya, you need to look for an algorithm that would fit best, okay, the symptoms or the criteria of your algorithm. So in this particular case, is there a pulse? The next question of the team leader would be, what is the pulse rate? So you need to palpate the carotid pulse. Do not check the heart monitor on your ECG. Okay, sabi ko nga, there is a difference between depolarization and your contraction. Ang gusto nating malaman dito is the heart rate that is being emitted to your heart of your myocardial cells. So, kailangan natin malaman kung there is contraction or wala. So, kapag less than 50 beats per minute, we can use this particular bradycardia algorithm. Now, what will be the next question of your team leader? Of course, okay, ang next is yung i-check niya ngayon yung tinatawag nating A for airway. A for airway. The question now would be, is the airway patent? Is the airway patent? Okay, he needs to check whether it's a yes or a no. So pag sinabing yes, okay, ang gagawin lang natin is maintain patency. How would you maintain patency of yung airway natin? Okay, maintain the position of the airway. So ibig sabihin yan, position siya ng, okay, meron tayong ginagawang maneuver dyan para ma-position natin ng patent yung airway. We're going to do your head tilt chin lift. You're going to do your head tilt chin lift. Okay. Now, what if, for example, the airway is not patent? Of course, ang sasabihin ni team leader would be, make it patent. Make it patent. So, sabi ko nga sa inyo, there are 3 things that we can actually do to maintain the airway pattern. One of it is positioning. You can do head to chin lift technique or yung tinatawag nating jaw thrust maneuver. Jaw thrust maneuver. And when is jaw thrust maneuver being done? Jaw thrust maneuver is being done if you have a suspected spinal cord injury. If you have a suspected spinal cord injury. Now, if you have a suspected spinal cord injury, so hindi natin pwedeng galawin yung neck area ng pasyente. Why? Because of possible dangers that you might affect your spinal cord. So, pwede nating makakreate pa ng mga possible complications sa pasyente natin. But, okay, this is what American Heart Association actually dictates us. If you're having a difficulty doing your jaw thrust maneuver to your patient, if you're having a difficulty jaw thrust maneuver, you need to document this and then maintain head tilt chin lift despite you are considering your spinal cord injury. You're considering your head spinal cord injury, you can do head tilt chin lift provided you attempted and did your jaw thrust maneuver and you had a difficulty. Now, let's say for example, head tilt ka ng head tilt. Alam mo namang very good yung paggawa mo ng head tilt. Pero there is still there is compromising now the airway. Okay, probably the patient have possible secretions. So you need to what? You need to do suctioning. So you need to suction the saliva or the secretions of the patient to maintain the patency of the airway of your patient. Now, what if, for example, you did your head to chin lift, you did your suctioning to your patient, and still you're not considering any patency of the airway? Probably you can use yung tinatawag nating airway adjuncts. Airway adjuncts. You're very much familiar with your airway adjuncts. Okay, these are your oropharyngeal airway and your nasopharyngeal airway. Your oropharyngeal airway and nasopharyngeal airway. Okay. So these are the things that you can use to maintain patency of your airway. Positioning, suctioning, and your airway adjuncts. Next would be, of course, breathing. The question now that would be raised by your team leader is the patient breathing? Is the patient breathing? Of course, ang mag-check ng breathing natin would be your ventilator. So the ventilator would have to check if the patient is breathing. When the patient is being checked, okay, you need to know whether humihinga siya or hindi. So how would you do this? You're going to look, listen, and feel. Look, listen, and feel. So now, if there is breathing, the answer is a yes. You can actually check the O2 saturation of the patient. Why? Because it says here, if the O2 saturation is within 90 to 94%, you can give your oxygen via nasal cannula at 2 liters per minute. Basta ang O2 saturation mo is between 90 to 94%, you can give your oxygen at 2 liters per minute via nasal cannula. Now, what if, for example, it goes beyond 94%? It goes beyond 94%. Would you still give an oxygen via nasal cannula? No need. You just have to keep the patient breathing on room air. Keep the patient breathing on room air. Now, what if, for example, the answer provided to you by the ventilator is a no, the patient is not breathing? I think I mentioned this one a while ago during your cardiac arrest. The patient has a pulse and is not breathing. What you're going to do? You're going to give rescue breathing. Okay, how? You're going to do rescue breathing, 1 breath every 5 seconds for 2 minutes via your bag valve mask. Via your bag valve mask. 1 rescue breath, okay, every 5 seconds for 2 minutes. For 2 minutes. Now, after letter B, of course, after letter B, you will now check for letter C. And what is letter C? C for circulation. C for circulation. So, the question now of the team leader would be, what is the BP and O2 sat? What is the BP and O2 sat? Why? Okay, if you notice, bakit natin i-check ulit si O2 saturation dito? Binention na natin siya saan? Sa breathing. But if you would notice as well in the breathing, chinek lang natin ang O2 saturation natin if the patient is breathing. Now, what if, for example, the patient is not breathing? Di ba hindi naman natin chinek yung O2 saturation ng pasyente? Ang command ni team leader is to just manage giving rescue breathing. Okay? Hindi natin pina-check yung O2 sat. So, if the patient is not breathing, always check the O2 saturation. Please be reminded. Okay, if the patient has a pulse and is not breathing, okay, after doing rescue breathing, check the O2 sat as well. Why? If the O2 saturation is 94% and above, you're just going to continue on the rescue breathing. Now, what if, for example, below 94 siya? Below 94%, you can now do your advanced airway management. Advanced airway management. So, ibig sabihin yan, you can now insert your endotracheal tube. And who's going to insert your endotracheal tube? Who's going to insert your endotracheal tube? It will only be the physician. It will only be the physician. There is no certain way that us nurses can actually do this, even we are skilled. Even if we are skilled, you cannot do EP insertion to your patient, even if you are skilled. Now, what can you do to your patient? Okay, paano kung kunyari there is no presence of the doctor or physician that can actually insert the endotracheal tube? There are certain devices that we can actually use besides the endotracheal tube. What are these? You have yung tinatawag nating LMA. LMA. Now, what is LMA? LMA LMA is laryngeal mask airway. Laryngeal mask airway. Your LMA. Okay. Now, how would we actually insert this one to your patient? Do you need a laryngoscope to actually position this one? No need for a laryngoscope. You're just going to make sure that the tip of the laryngoscope is in the esophagus. Esophagus. Blocking now the esophagus. Yung tip niya is blocking the esophagus so that the air can go directly where? Can go directly to the trachea. So, kaya ginawa siyang ganyan, well, it's because